if you don't do something, you're going to be stuck in a bad situation.
What are some things that people can do before it becomes very chronic?
Some people walk out and say, well, the doctor said I'm fat. No, I didn't say that you were fat.
There is alternative remedies or alternative things that they can do before.
It simply hurts so much that you can't adapt or adopt to it without help.
Welcome to the Integrated Mind podcast, where we help you connect your mind, your body, and your soul. I'm your host, Gottlieb, and I have an amazing co-host today, actually guest, and this is Dr. Jonathan Gottlieb, which is also my husband on a personal level and my partner in a professional level. So welcome to the podcast today.
Well, thanks. I'm so happy and so honored to be a part of this. This is something that has been an evolution of ideas for you for so long. You've had so many thoughts and so many iterations that have finally come to where we are now, and I'm just very proud of you. So I want to start off with that.
Thank you. So today's topic is basically what we always do on these episodes is how does your mind and your body apply to spine surgery and pain, essentially, right? So who could not be the best host or the best guest for this podcast than my husband, who is an orthopedic spine surgeon. And I also wanted to talk about which was how we are connecting and how, when I said you're my partner also in my professional life, which is we are integrating our practices and we're becoming one. And I want to talk about how that idea came to fruition.
Well, I think that, for me, this really goes back a long time. During my fellowship in North Carolina, I became familiar with a concept called functional restoration. And essentially, the principle there was that every patient with comprehensive or chronic pain was complicated and individual. And so the treatment plans were really individually tailored. This was really for patients who didn't just have a surgical problem or didn't just have a pain management problem, that a number of different disciplines had to be involved. And by doing so, the outcomes were substantially improved. And specifically in dealing with the patient populations that were the hardest to get better. So there was one facility where I think this really started that took workers' compensation patients with chronic back pain who'd been out of work for about 2 years, which historically they never returned to work. Less than 1% really would ever return to work. And they got about 90% back to work through this program. And so I found it interesting. So what do they do differently? There's obviously the surgical role. As a surgeon, that's what we think of, but there was a lot more. Physical therapy, psychology, nutrition, cognitive behavioral therapies, and really everything else to support those individual patients.
So it's integrating also not just the physical body, but also considering all of the other factors that play a role.
Exactly, because there are a lot of people with structural problems that are fairly easy to fix, and sometimes they still don't do well. Mm-hmm. Now, some of it comes down to biology. There are just times where a nerve isn't going to heal no matter what you do, and that can be a biological misfortune.
But through therapy and mental health and integrating what is mindfulness, it could even if the patient cannot get completely better, they can still mitigate the pain by working on their internal selves.
Exactly. And I think there are some people that historically we would say, well, they just didn't get better and I don't know why, and that's the end of it. And I'm going to send you to somebody who's probably going to start you on pills that are going to make you miserable for the rest of your life. Or is there something else we can do? And over time, I started to realize something, or at least I started to think I realized something, which was I could get a good sense for how somebody was going to do after the surgery, even before the surgery, beyond simply the complexity of their problem, but based on their outlook and the way that they were processing what I was saying to them, almost the way that they would make me feel. And when I see patients who were anxious, I would expect a lot more anxiety after surgery. When people had a negative worldview, they tended to not do as well. And so it kind of brought me back into that concept of the functional restoration and that connection between the body and the mind.
Which is how we're merging now.
Exactly.
So
right.
You were telling me all of these things that you wanted to create that you had seen and experienced to a certain degree, and how you can bring that into fruition now in your independent practice. And for those that don't know my history in the past, that haven't seen the past episodes, I came back to this type of work. So the therapy work, the mindfulness work, the spiritual work, more or less at the same time when we were having these conversations of you saying, I wish I can create something that incorporates more than just surgery, how I can help these people have better outcomes. And that's kind of how we decided to merge together.
Exactly, because it's more than just the more than surgery. Mm-hmm. A great physical therapist makes a huge difference. A great pain management physician helps a lot too. But still, there's a lot that kind of falls outside the realm of the traditional medical care that I could deliver or my colleagues could deliver, no matter how good they are, and really have great people in the field supporting us. But there was still that bridge that had to be gapped, and that brought us together on this. And you know, you've already made a big difference in the lives of several of my patients, people who I think historically would not have done nearly as well as they have, but for the things you've been able to offer them, and really often just a few sessions.
Yeah, thank you. I mean, it's scary. I mean, anybody that's going to go to see if they need spinal surgery is not something that's easily swallowed. I mean, there's a lot of fear there. There's a lot of hesitation, a lot of anxiety.
No question. I mean, nobody walks into my office having a great day. I mean, hopefully they leave feeling a little bit better, at least, you know, perhaps about what we can do for them. But you know, whenever somebody walks in, of course, I greet them. How are you doing today? Realistically, I know that they can't be doing that well, because no one's going to spend, 2 hours getting to the office, being seen, going home, unless they really had a reason to do that. But I think through that understanding of where they are coming in, to your point, about that psychological distress that affects everybody. I mean, as you know, I've had half a dozen surgeries myself. It's anxiety provoking, and I know what's going on. For people who don't, for people who are afraid, especially if something just hurts in a manner that's otherwise incomprehensible.
Yeah, you don't even have time to even really process. You're so focused on what's going on in your body and the pain that you're feeling, that the thought of anything else is, you just don't have the energy.
No, you don't. And it's hard. And I think the greater the degree of pain is, intrinsically, we think it's a bigger problem. And frankly, some things hurt so bad that even if you could rationally understand it wasn't a huge problem, it simply hurts so much that you can't adapt or adopt to it without help. And that's where I think that the psychology really comes in, and what you're able to do with kind of, okay, you've got this problem. The first thing is, where we're going to get you, and the magic that you work, and I don't want to pretend that I know how it works.
No, it's very different. It's very different. You go in there with your hammer and all of these big, I call them Home Depot hammers and cuttings and things like that. It's very different. I don't have any of those tools. My tools are more of connecting and really trying to understand where your patients are at and how I can serve them by eliminating a lot of the unknowns, by eliminating a lot of those questions, right, that they have, and maybe they don't even know how to ask you, or even don't know how to even ask it. But through the rapport and the process, I'm able to kind of soothe that.
I think that's a big part of it. Even though we really try to take our time with the patients and let them ask every question that they have, even still, there are a lot of questions I think that they're not comfortable asking. It's outside the realm of what you're typically going to be asking a surgeon. And there are a lot of other factors there too. You're being told maybe that you have to have this operation. From that point forward, it's hard to remember much of anything. So there are some studies that have shown, I think, about 10% of what is said in a doctor's office is actually recalled. Which is why
it's very true.
Yeah, which is part of why everything that we run through about the surgery, if we're going to offer one, the risks and benefits, we also give people written documentation so they can refer back to it. And that way, if they have any other questions, they can ask. But still, that leaves essentially no time to deal with the psychology. And frankly, I'm not an expert in that. And we know it has to be addressed. I know that it can't be done. And this is tantamount to, I need medical clearance from an internal medicine doctor, but I can't get it myself. Well, we also, I think for a lot of patients, and you could argue for most, perhaps even almost all, probably need some degree of psychological clearance, or at least optimization before surgery, because the goal is to have you in the best position for a great outcome after surgery. And yeah, your blood pressure better be okay, and your blood sugar better not be 2,000. But there's more to it than just that. And I think this has been neglected in the past, although the studies now are showing that it really does make a difference.
Can you talk a little bit about that?
Yeah, we've known for a long time that patients with anxiety, depression, blame tend to do less well after surgery. And now we have some more sensitive instruments and some of the studies that are really demonstrating the disparate outcomes. And the question becomes, okay, what do we do about it? It's great when you have information. What makes that actionable? What do those actions entail? And this is what brings us to where I am now. I believe that something like a functional restoration program works great. That's probably overkill for most patients. I do think that there's sort of a fine line between doing too little and then just being excessive.
I love that. And I'm sorry to cut you off, because I always talk with my patients or my clients of ideal and reality, right? And a lot of people don't understand the difference. They always say, I need to do A, B, and C, and D, E, and F, right? That's the ideal. That's the perfect situation. But how often is that really realistic?
Well, I think that unfortunately we live in a resource-limited world, right? I mean, if there were no limits on time, if there were no limits on finances, if there were no limits on people to provide these treatments, yeah, we would like to do a lot more. But that's not reality. So the question is, what is it that you need to do for that person? And you kind of determine what that is, with the understanding that some people need very little. Some people walk in and they have a very fixable problem. They're well grounded. They don't need anything basically but going to surgery and getting a piece of disc taken out and getting back to work. Some people have really comprehensive problems, whether it's a metabolic disorder or significant psychological distress. Again, maybe the blood pressure responds to blood pressure pills, but maybe they're going to need a few weeks, even a couple of months of supportive mental health care before and even after to optimize their recovery.
Okay. Outside of mental health, obviously the psychology of it and more of that internal work. How about outside of the surgery aspect, right? Which is where you come in. What are other things that are significant factors that play a significant role in the outcome of surgery that has to do with the body, the physical body?
As much as I would love to say that great outcomes are my work and bad outcomes are somebody else's fault, it's really never that simple. But I think that really the single biggest factor that discriminates between very good outcomes and not great outcomes is usually patient-related. For the most part, we execute the surgeries technically very similarly. But there's obviously patients' overall health, their physical health, the stuff that you're going to see on a laboratory study or see on an x-ray. And then there's their adaptability and what is it that they expect. And I tell all of the patients going into surgery some iteration of, if you're going to move forward with this, you need to start envisioning your great outcome right now.
I love that, the envisioning part. Sorry, I got excited.
No, but I really do believe that, though, that if you can see where you are now and see where you want to be, it's a lot easier to get there. And as a general rule, and obviously it doesn't apply to every person, but the people who are less confident in that, the ones who are more afraid, the ones who are wondering, the ones who are unduly nervous, it's a lot harder for them to get there. And so to the extent that I can help people, I'll tell them, to manifest that future that they want to see. And if I think there's going to be an impediment to them getting there, I'll encourage them to get additional care, just like I would if they had some other medical condition that I thought would prevent them from getting where they wanted to go. So
prevention, that's huge. Because I know nobody, obviously if you need to have surgery, you've tried, I'm sure people will do their due diligence and try all of the things possible not to have surgery. But what are some things that people can do before it becomes very chronic and acute to prevent situations or even a visit with you?
Well, I think the first thing too, just kind of going back into where we let off, it's not like most of the patients we see end up needing surgery. Most everybody comes to us for a surgical evaluation, but it's still maybe 10, 15, 20% of our patients actually become surgical. And the reason for that is, first off, most problems, to your point, don't require surgery. I think that the general rules for avoiding seeing me are very similar to the general rules for avoiding any other medical condition. Take care of the body. That's the first step. You know, we have a culture that I think is a little bit hedonistic when it comes to eating, and with the use of substances, alcohol, other intoxicants. And there's no question that the average American now is significantly heavier than they were a generation ago. We have just burgeoning chronic diseases striking people at a younger age than they ever did before. And we know that that's bad for your heart, it's bad for your brain, it's bad for your liver.
Sedentary lifestyle too.
Exactly. But it's also bad for your musculoskeletal system. So we have people basically living an unhealthy intake lifestyle. And then on top of that, exactly, the activity level is very, very low. A lot of Americans take fewer than 3,000 steps a day. The majority of their life is spent sitting, looking at screens, on the phone. Usually, well, at the same time they're eating something they probably shouldn't be eating in the first place.
Ultra-processed.
Exactly. You know, these things that really have no, I would argue, have no place on our table. They certainly don't have a place in nature. It's not like you can find them growing anywhere or grazing or swimming. And so those are relatively simple, not easy, but simple things to do.
Yeah, I mean, I would say movement, right? Just move. It doesn't have to be you going to the gym and doing all these weights. A simple walk.
Yeah. If you can get up and spend a minimum of 30, but ideally 60 minutes a day moving, that in itself is going to have a profound effect on your physical health. I would say also probably on your mental health too.
Oh, absolutely.
But the combination of bad foods and lack of movement, I think really sets us up for a lot of what we see. So people are deconditioned, they're overweight, they have a low muscle mass, and that predisposes you to becoming injured.
That's the thing. And people don't understand the correlation with that, right?
They really don't. And then if something hurts, people say, well, I'm just going to stop doing something. I'll stop activities because it hurts. But that's really the wrong answer.
Oh, that's a good point.
So again, I'm not talking about, say, a broken leg. You're not going to walk that off, obviously.
No, of course.
But people very often have chronic back pain. And many of those people will just do less and less and less. So the muscles get weaker. Very often they'll gain weight. And they have this maladaptive response to the pain that they're experiencing, which is, okay, I'm going to avoid it at all costs, which is doing nothing. But
Making it worse.
Exactly. It perpetuates the cycle of worse degeneration and worse deconditioning. And interestingly, those are the hardest patients for me to fix. It's a lot easier if somebody comes in good shape with an acute problem than somebody who's neglected their well-being for 20, 30, 50 years and then says, make me a teen again. And that just can't happen.
So what do you do when a patient comes in that is probably not ideal for surgical intervention? So how have you handled that in the past, and how has it changed, or how has the person, you know where I'm trying to get?
Yeah. Sometimes it's hard. There are some people who are really, I think, interested and capable of hearing that message, which is, I don't think I can make you better with surgery. And I'm never going to take somebody to surgery that I don't have a great confidence I can help, because I can never guarantee it. But if I'm thinking it's not a good idea, we're never going to go back. And so somebody comes in with something that I don't think is fixable, but they have other areas of potential intervention, I will encourage them to explore that. Some people want to hear it. Some people walk out and say, well, the doctor said I'm fat. No, I didn't say that you were fat, but you are overweight. And your back pain is never going to get better unless we do something about that. No matter what else I do, no matter how good the pain management doctor is at the injections, no matter how much that other pill helps you, if we want to really fix your problem, we have to start at the core.
I love that, because that's kind of like my foundation, right? It's kind of like, for me, is you have the power to improve your own life, right? You have all of the tools there. It's really up to you to embrace that and really activate that, versus I'm going to keep getting injections, or I'm just going to be taking this anti-anxiety medication, or all of these other things that are outside of us, right? Which then I would say perpetuates the negative emotions, because when you have no control, that brings up anxiety and disillusionment. You know what I'm trying to say?
For certain. And I think that it's really looking at it in a very simple dichotomous fashion. You either own it. This is my problem, and I'm going to do every single thing I can to fix it. Or, to quote Homer Simpson, this is everybody's fault but mine. Mm-hmm. And the people who look at it in the latter fashion, they're probably never going to get better, because the solution is not in the list of problems that they're evaluating. The solutions are internal, they're inside. You have health conditions that can be addressed. Again, I'm not saying it's easy to lose weight. I'm not saying it's easy to stop smoking. It's not.
No, I was going to say it's not. It's not easy to take responsibility. It's not easy to, sometimes I ask my clients this, is like, where is there any fear because in actually succeeding? Because we don't even think about that. We say, okay, we just want to succeed. Let's succeed, right? That's great. That's wonderful. But there's also a fear in that.
There is. I mean, because again, you go from a known to an unknown. Mm-hmm. Absolutely, there's a fear in that. I suppose there could be a fear of failure for a lot of people who really hear, hey, this is on me. And I've told people in the past who I thought we could potentially get to accept that maybe weren't quite there, that nobody can care more about your well-being than you can, no matter how much I want this for you. And sometimes I'll even say, I gain nothing from this. So if I'm giving you this advice, I'm telling you to do something that I believe is in your absolute best interest. And I would hope you would consider.
Because for your best interest, if you really think about it, would be, let's go and, let's have surgery.
Absolutely. I mean, at least, from a financial standpoint, right.
Yeah.
I mean, looking at it from that perspective, yeah, everybody I operate on.
Which is something that I admire about you, by the way, that you really take the time to assess your patients and evaluate if there is alternative remedies or alternative things that they can do before, and you leave surgery as the last option.
I think the way that I look at it is this, and thank you for saying that. Sometimes the conservative thing to do is to intervene early. If somebody has spinal cord compression, we're not going to send them for conservative modalities because that's condemning them to a worse outcome. At the same time, the vast majority of things that we see are non-emergent. The vast majority will do well with non-operative care. And even if they don't achieve the goals that they were looking for, if they do come to surgery, they will do better having gone through those exercises. But absolutely, I try to reference that with the patients as well. I'm a surgeon. I'm telling you not to have surgery. I hope you can appreciate that is coming from a place of what I really believe is the best thing for you. And I'm not trying to be dismissive or tell you that I think there's something wrong with you or you're crazy or anything like that. Again, there's what you say and there's what people hear. And sometimes no matter how you deliver the message, no matter how carefully you try to word it, people aren't really open to hearing that. And I do the best that I can to get them to do so. And sometimes I'll just say, look, maybe the best thing, if you've never spoken to somebody, do so. If you have any faith that you lean on, do that. But take some time and really think more before you decide what our conversation really meant.
Do you have can you talk about a case that you've had that you've seen the difference in the way that they think and their attitude and how their outcomes were and versus a person that didn't? I know you talked statistics but I want to know your personal experience.
Well, I've seen it with a number of patients, and I think it's really most striking when people are dealing with sentinel events in their life. Something big or horrible has happened, and they will usually think that they're better off than they really are. So they'll come in, and sometimes I can think of somebody recently who had a disc herniation in the low back, a lot of terrible pain, but it also sustained a couple of losses, and surgery was perfect. Pain was gone. But this patient was really just as miserable after the surgery, and not because they still had the leg pain, but because the major episodes of life were preventing her from moving forward. And that, when you look at it from the objective surgical outcome standpoint, well, that really wasn't a very good result. But I think that's a little bit of a fatalist view, because I think we can still get that result, and we will get that result. This is a rather recent surgery, which I think I told you about. We will get that result because she has accepted the importance of really dealing with everything else that's going on in her life, and is actually very acutely aware of how that has affected everything.
That's important. It's important. I mean, it's integrating, right? The mind and the body. And when I say the soul, I always reference like your authentic self, who you truly are, and all of those things, which plays a role because what we just talked about. We talked about how people will not want to face situations or things, right? And it's like, what are you hiding from? What's going on internally that is truly affecting you in your physical life right now? So that is, you're not living authentically, you're living out of fear. You're living out of fear, you're not living as your individual person.
Right, and fear can be a great motivator. I don't mean that in a good way. Right? Fear is something that is a very effective mechanism by which people have been controlled throughout history. But your own fear controls you too. And, people will allow their fear to prevent them from making otherwise rational decisions. And we're all guilty of it. We've all been guilty of it. But sometimes it is really going to result in a worse outcome for somebody long term. And there are people, going back to surgery, that example, who are so afraid of surgery that no matter how bad their situation is, they won't have it. And they will try everything. And very often they fall victim to the modern day snake oil salesman. People who will promise things that just have absolutely no scientific merit, that usually cost a lot of money, sometimes have to be done in places you wouldn't necessarily otherwise want to go to. But because they're so afraid of so afraid of surgery, they will put their rational thinking aside and say, well, I'm going to try all of that because surgery is the absolute last resort. They might drag their leg back in 2 months later and say, well, that didn't work, and I'm $15,000 poorer than I was. But they still went through it. And eventually, sometimes they will overcome the fear. Some people won't. And they will accept terrible disability that would be fixable. And that's, I think, a little bit personally and professionally frustrating. I can't force anybody.
The fear of the unknown. And that translates in all aspects of our lives. That translates into difficult relationships. That translates into miserable careers. That translates into all aspects of our life. Our nervous system will rather feel bad but knows what's going to happen than leave. Even if the potential of leaving is a better outcome, it's still not sure. So I'd rather stay in the most miserable state but know what's happening.
Yeah, it's like the devil you know. Yeah, this is bad, but boy, that could be worse. And it kind of also comes down into possibilities versus probabilities. I think a lot of people who are impaired by fear are very much limited by the failure to distinguish between the two. Anything is possible, right? It's possible that little green men will beam down right now and pull me right out of this room and I'm gone. But it's pretty darn unlikely. And if you realize that, yeah, sometimes a lot of things can happen and a lot of bad things could happen, but the likelihood is really, really low versus the overwhelming likelihood that if you don't do something, you're going to be stuck in a bad situation. So the possibility of, well, my gosh, this could happen, therefore I can't move forward, it's not logical.
But there's the emotional concept there, and it goes back to how stable are you mentally, emotionally, basically.
There is. Well, I think to some extent we're all potentially victims of dissonance. On the daily, we all do it a little bit. Sometimes it's on a more grand scale when it comes to something that's going to really profoundly affect you. It is still disturbingly easy to dismiss good data in favor of bad data, which is supported by your emotions.
That's very true. Just because you feel something doesn't mean you're right.
Exactly. And you can't always just will it to be true.
Exactly.
And the positive outlook is very important, but it can't be ignorant of reality.
Mm-hmm. So. Yeah. Ideal versus reality. I want to kind of shift a little bit, and I'm going to put you on the spot.
Terrific.
So we've talked a lot about how patients can improve their outcomes of surgery or even prevent surgery due to taking care of their bodies and making sure that internally they're ready, emotionally and mindfully ready for a process like surgery. But how about you? How do you integrate your mind, your authentic self into your physical body, let's say in surgery or in general life?
Wow, you really put me on the spot. Well, it's been a huge evolution for me as well. As
I think it's important. I think it's a huge growth for you.
Well, as anybody who knew me in my younger years, and I would include that probably up until the last couple of years, I have always been high energy with some perhaps degrees of excitability and. Maybe I would demonstrate my frustration in things, and I can only imagine if any of my former, if my co-residents are watching, they would tell some stories. But anyway, and it served me well. Interestingly, in a lot of aspects of my life, that kind of drive really has. It
That's
helps me.
very true, and I don't want to cut you off, but I'm going to because it's about balance. It's not going from one extreme to the other extreme. It's learning because both sides have value, right? Extreme behaviors, if you bring it down a notch, has great value, even if they're negative or categorized as negative. So it's about finding that balance between the extremes. So not shunning that side of yourself, but embracing and learning about it.
Well, exactly. It's sort of knowing when to turn it off and turn it back on.
That's mindfulness.
Yes, which really was a word I didn't know existed up until a couple of years ago. And that's the truth. I really had no idea
I want you to, yes,
existed.
exactly. This is very authentic. That's the purpose. But it's right. So I want you to really open up to that in this moment.
Over the years, I came to realize a few things through my own experiences and observations of other people that in high stress situations, there are really, I think, two ways to accommodate, and really only two. You can either become effectively focused and controlled, or, as you often see, people lose their noodles. Kind of like when you're driving on the roads in Miami and something happens and somebody gets cut off, there's just a lot of
emotional outbursts.
And nothing good ever comes out of that, right? And that's an example we see every day. Well, the same thing really applies in surgery, because as much as I would love for every surgery to be perfectly simple and without issues and just very seamless, that's not reality. And so the question is, when something happens in every surgery, how do you deal with it? Because a little something's going to happen in every surgery, not anything that bears mention, but something that can potentially affect how everything goes. And the first step I've learned over time, very much over time, was to just take a step back and say, okay, what's going on? Even if it's just thinking about it for 2 seconds, taking a breath and moving on. Because that prevents the scope of view from closing in. And it's kind of like, as we were talking before about, say, plane crashes. Most plane crashes aren't the result of some single catastrophic occurrence. It's a series of small mistakes that go unrecognized. Same thing happens in surgery. And so my default when I was in training, and even in the beginning of my career, was if something didn't go how I wanted, it would upset me. It would stress me out. And usually we'd ultimately get to where we had to get from an outcome standpoint, but it was unnecessarily complicated. And I would probably say, if I look back, there were going to be times where I didn't execute as well as I could have. I don't remember any catastrophes, I really don't. But nonetheless, I'm sure that's the case. I've learned that going into surgeries now with a calmer mind also helps me do that. And so before I go into surgery, I always take a few breaths. I always have a little bit of an internal dialogue.
I love that.
And say in a lot of cases, just say a quick prayer, something to bring my mind into the place where I'm prepared for whatever is going to happen. And if nothing happens, terrific. But if it does happen, I'm already in a space to where that occurrence is not going to dictate the pace or the outcome of the surgery. And so that's really where I am right now. And I think it's part of why I go into surgeries now with no concern or no fear. I have absolute respect for what we're doing, never flippant about it. But I also do believe that no matter what happens, we're going to be able to achieve the goals we set out.
That's awesome. That's wonderful. I get chills. I mean, that's connection, right? That's connection with who you really, really are inside.
I think it is. And I think it also affects the flow of the room, because kind of getting back into that airplane example, when the surgeon gets stressed, everybody in the room is stressed. Mm-hmm. The assistant,
contagious.
The scrub tech, the nurse, the anesthesia team, and everybody's more prone to making mistakes. Again, I think this is applicable to life in general. If you're in a situation, if you're leading people, or even if you're just around people, if you lose your noodles, they might too. So if you want to optimize outcomes, if you want to help keep situations controlled, it starts with controlling yourself. Mm-hmm. And I think just in what I do, obviously the stakes of doing so are pretty high.
Yeah, I would say so. How about in your personal life? How do you integrate that? What do you do to kind of get more centered and to really take a step back and see the bigger picture versus something from just your own lens?
See, I thought you were going to put me on the spot with the work questions. Now you're asking me personal questions.
Well, because it overlaps, right?
It does. No, it really does. Well, again, same thing, which you can obviously speak.
You're blushing.
You can speak firsthand to. My native innate reactions to things are not always optimal. They're not adaptive. And I don't think that I'm alone in that.
You're not.
And something that I would perceive through the way that I see things, because I can only see things one way, which is the way that I look. So the question is, how has that become more controlled over time? And I think the first thing is, whether it's in dealing with you, my friends, my coworkers, my kids, or our kids, whoever it is, it's okay. Let's take a step back. Kind of like before going into surgery.
Exactly.
I need to be in a good mind space. Now, am I reacting to something because somebody did something that is worthy of reaction? Am I perceiving something because I'm stressed or in a bad mood or distracted? Or was it just a bad communication? And I think it's really brought me to the default of this, that, especially the people who I care about and the people I love, is, all right, you're coming from a good place. So if there's something that seems off, let's kind of go to that default. What am I not seeing? What am I seeing that is not reality? And it's helped. I think it's made me a better father. I think it's made me a better husband. I'd like to believe that it translates well into the life with my coworkers at the office, within the hospital, and of course, within my friends, always kind of going back to good people are starting from a place of good.
Mm-hmm. It's very similar. I love what you're saying. You even ask yourselves, like, you try to understand. And I have this process, which is pretty much accepting that this is happening, right? You start questioning, what's the scenario? Where is this coming from? Why am I reacting this way? What is the real, like, how can I see it from another point of view? So questioning, understanding through the questioning of the scenario versus having that tunnel vision and only looking at it from one scenario. You start opening up your perception to the experience, and then you accept it because you've done the questioning, you've done the understanding, you've really been mindful. And then that's where the transformational process begins, which is you're not reacting, you're being mindful through that process, through the acceptance, the questioning, the understanding, all of that.
Well, and it even makes it easier for me to achieve my goals because, as you know, I like to look at things as analytically as possible. Emotions, especially negative emotions, will get in the way of that. And so whatever the problem is, whatever the issue is, if we can basically get the head off the top and say, all right, what's really happening here, then it can be effectively processed, both, I suppose, with a better emotional state, but also with a better rational state. Mm-hmm. And that helps a lot too. And that helps quite a bit professionally. I mean, clearly, negative emotions don't help you make better decisions with anything. Nobody ever looks back and says, boy, I wish I was angry. I would have made a better decision. I wish I was more anxious. That would have helped. You know, no one ever looks at it that way. No. And so whether it's a business arrangement, whether it's a negotiation of some sort, it's really similar, other than obviously the personal connection.
Mm-hmm. Yeah, and I think you kind of start disconnecting, but you from what you mentioned, you start disconnecting emotionally by taking that deep breath, by being present in the moment, versus continuing with the loop of thoughts that are really based on past and from the limited exposure or the limited information that you have that came to you initially. So taking that deep breath, getting present in the moment, questioning the scenario that you're in, whether it's surgery or whether it's your personal life or your social life, before reacting, right? To try to understand why you're feeling these ways and why you want to react a certain way, and trying to see it from a bigger perspective. And then once you understand it, you can actually change, accept, or you actually have control, you have power.
Right. And more confidence that sometimes someone's just being a jerk.
Yeah.
And I say, okay,
and which is fine.
This,
yeah.
You know, is this me or you? And it, well, not ever you, but you know, if it's the other person, say, okay, really, what is going on here? Okay, what is their motivation? What is driving them? Has something else upset them? Mm-hmm. Is there something that I'm not seeing? And then sometimes it gives you the opportunity to really reflect things back on them, because two people yelling is an argument. One person yelling is a maniac. And if you can control your emotions, or I can control mine, sometimes that'll allow the other party to just calm down and be more introspective.
Mm-hmm. I mean, it's kind of, you mentioned something like when you're in the operating room, it's not going to help if you get frantic, or if somebody else gets frantic, it becomes contagious. So you have to make sure that you have somewhat of a shield, right? To take a breath, be present, analyze the situation, and then act, right? And that overlaps in your personal life and your social life as well. You go through that process versus, and that's living authentically, right? Versus reacting all the time to any stimulus that comes your way.
And there are some adaptive reactions. I mean, obviously, if you're driving, you don't have time to think about why somebody cut you off.
Well, no.
And so it's not to say that, every thought in life is deeply ponderous. Again, it's when do you turn it on? When do you turn it off?
It's the balance.
Yeah. So
it's not going one extreme to the next. Is learning. You're absolutely right. Things that, and I always say, what is bothering you? What is it that you want to grow? How do you want to grow? How does that look like? Because that's another thing that people say, I want to be happy or I want to do this. Okay, that's great. It's a general statement. But how do you get there? What are the steps that we need to get to that point? And that's where a lot of the resistance comes in.
I think that's probably one of the biggest reasons for failure overall. And I've talked about this with my cousin, Mike, that a lot of people know exactly what they want to do, but they're not willing to put in the time to think about how to get there, nor the effort to do so. And so they're always going to do something, but they're never doing something. Kind of sitting back and saying, okay, I want to get here. Here's what I have to do that. And then actually executing it again. It goes back to, it's not a hard concept, but it requires a lot of commitment and ownership. And I go back to that, own everything. If this is something that affects consider how you can impact it.
So going back to talking about how we are also partners in our professional life, let's talk about a little bit of how you have evolved your practice and are in the process of evolving your practice and how we're working together and how we're opening up an office next month together. Let's give a little bit of details from your end.
Yeah, so we're very excited to be moving to Coral Gables, 475 Biltmore Way Suite 101, just to throw that out there. And thank you to the various and sundry inspectors who have finally given us the green light to move in.
Okay.
You never know who's going to watch this, but we've talked again quite a bit over the past couple of years of how to integrate what it is that you do with what it is that I do. And so with the move, obviously you're going to be getting into the office first, but we're going to be sharing space together, as well as with Nicole, our integrative nurse practitioner, to really try to bring together, to the extent that we can, everything, not everything, but the essential elements related to getting good outcomes for our patients. It's not going to change the fact that the majority are not surgical patients, but I would even say that a lot of people who are not surgical will benefit quite a bit from the integrative side, focusing on their health, simple lifestyle changes they can make.
That's the thing,
yeah.
Right? Is giving that tweak so they don't have to end up on the operating table, right?
Yeah.
Maybe, you talked about things that you do need to address in the moment that are emergent, that are obviously that you just can't do anything else. It's like a broken bone, right? You can't forget a broken bone and do something else with it. You have to address it at the moment. But for the people that are non-surgical and still having back pain, lifestyle modifications, which is where Nicole comes in, or an evaluation of what's going on physically that is not tied to musculoskeletal, and what's going on emotionally and mentally, is resources that we can provide to the patients that they can go home with. Because the worst thing, at least I think about myself as a patient, I don't want to go into an office and they tell me, you know what? You're not surgical, but I still have pain. Like, what else can I do?
Right, and people will feel dismissed, and understandably so. And I understand both sides of that. Because looking at it strictly as a surgeon, say, there's nothing I can do.
Exactly.
It is a true statement. The question is, where do we view our responsibility ending? It's fair to say that for a surgeon, if it's not surgical, there is no additional intervention. It's also fair to say, let me see what else might be an option for you. Now, I don't manage these things. I can't tell you what the likelihood is of you receiving any specific treatment or the benefit from that, but let me get you to look at these other possible
options that do play a role.
Helpers, if you will, complements to what we do. The integrative medicine, I think, is an easy one, especially the literature-based. We're not talking about injecting, I don't know, snake liver oil or anything like that in there. But really, there's actually some pretty good literature coming out now on, I think, more contemporary views of what we can do to decrease inflammation and optimize metabolic function, which I do believe does affect pain.
That's what I wanted to, yeah.
And that it's not to say that this is a substitute for physical therapy. And I have some great colleagues in physical therapy, and they do wonders for our patients. They really do. At the same time, in pain management, there are some really terrific pain management doctors who can change the lives of patients. It's really for the patients who sort of fall between the cracks. It's not a surgical problem. It doesn't just respond to physical therapy. It's more than just an injection. What do these patients need? And that's where we are.
Beautiful. The other thing I wanted to touch base is, how are you going to maximize and optimize the patients that are surgical, pre, post? Like, what are you doing anything different?
Yeah, and this is an evolving idea right now. So perhaps even from the time that I'm saying this to the time that it's seen, it could change. But I think that we are really looking toward having a more directed focus on everybody's responsibilities within the equation. We are, from a practice standpoint, myself, my team, our extenders, we're going to do everything we can to get the best possible outcome. But I'm really sort of working more and more toward expressing to the patients, this is what we expect of you. There are a lot of people who will offer you a surgery. I really believe that you're going to do the best if we optimize your nutrition, if we optimize your metabolic function, if we optimize your psychological well-being, your adaptiveness. It's going to be asking them to do more things in many cases. And some people might not want to do that. Just come in and fix me, and that's fine. There is somebody to do that. We are working more toward, in more cases than not, I'm going to ask more of the patients. I'm going to ask them to do more things, but really because I believe that is going to give them the better long-term result. And it's hard for me to offer somebody a procedure if I don't think it's the best thing. And if I think that there's anything we can do to make that even better, I'm going to ask that of the patients. Okay. And we're with them along every step of the way.
So just going back to our grand opening, we're going to be opening September 20th, and we're going to do an event at 5:00 in their new office. And that's basically for anybody that would like to come and see the office and see all of the services that we do provide, see the space, get acquainted, ask questions. We will be having this event September 20th at 5:00. Anything else you want to add to that?
Looking forward to it.
Yeah, I mean, at the end is giving your patients and my clients the best opportunity to maximize their overall health, essentially.
And, and I think it is worthy to just say one more time, what we're proposing, what we're doing is similar, but also different. And not everybody is going to be interested in exactly what we have to offer. We are asking more, but I also believe we're offering more. And as long as there's an alignment there, that really people are as invested in their well-being as we are, I think it's really going to work really well.
I agree. Thank you so much for coming on.
It has been...
It was great to have these discussions under the light and in front of everyone.
It's not recorded or anything like that.
But I'm so happy that you came and you're open to having these discussions. I know that it's a little bit different in your world to talk about even the mind and the body and all the benefits that it can provide for your surgical patients. But that's what we have to do, right? To break the mold and break the assumptions of things and really understand that we are one person. We're just not parts.
Exactly. And as you know, I'm your biggest cheerleader, not just at home, but also out in the world, because I really believe in what it is that you're doing.
Thank you. Thank you for joining us on this latest episode of Integrated Mind Podcast, where we help you connect your mind, your body, and your soul.